And I would like to invite our 3 speakers up for this afternoon, and two speakers and 1 virtual speaker. And we'll get on with the questions and answers. Yeah.
There she is.
And we have Reagan as well. That's great.
Woo-hoo.
Hey, Reagan.
I know she can't see us, but it looks way better anyway.
So first of all, Reagan, thank you for a great talk.
My pleasure. Thanks for letting me join virtually, everyone. Very excited to be here.
Really good to see you. Actually, with the questions, I can start off with one for you, if that's okay, Reagan.
Sure.
So the question is, your study showed urine or fecal odor didn't affect preference for these cats, but what about other odors, such as odors added to make litter smell more pleasing for the owners? Do they affect cats' preference? Did you look at that at all?
Yeah, that's a fantastic question. So in hindsight, I should have clarified it was malodor that we were studying in that particular research that I had shared. So that was specifically the odor of urine and feces, which is, from an owner's perspective, what they're trying to cover up. And so they had made this assumption that was bad for their cats as well. So that's what we were studying. We have actually done a lot of work around other scents as well. To understand for these additives that are being put into litter to kind of mask that malodor from the human perspective, how that impacts cats. And I can say that there are certain fragrances that just are not appealing for cats or do drive cats out of litter box. So this is something that we definitely need to be very careful with as we're designing litter products or setting up litter box experiences for our cats, that we're taking that into account. It's sort of one of those conflicts that we have between the humans wanting the box to smell very fresh and like perfume, and the cats actually not minding the smell of urine or feces in the box. So we have to strike that balance.
Sure. That's great. Thank you. So I've got a question for Jody. So this is an interesting question. How do we tease out the difference between cats who eat dry food being predisposed to FIC and cats who eat dry food who don't drink enough water being predisposed? So is it the dry food itself, or is it cats that are on dry food that don't drink enough?
Oh, that's a good question, and I don't have the answer to that. I think that is going to be a little difficult to look at, and I appreciate your insights as well. But I think, too, when we look at it as well, and we say, okay, dry food, and it's come out in multiple studies, right, as being a risk factor, and they do say it's solely dry food. But I think we all, too, have particular cats. I don't know if you all have one. They don't like canned food. You know, I have cats that they won't eat it. So I don't think it's just necessarily, I think it could be food preferences that go into that. And I don't necessarily think it's just urine dilution that is playing a big role in the responsiveness to this. So I think it's probably more complex than that. And when they were looking at some of those risk factors, you also have to look at some of the confounding variables that are going on in the household as well. So I think that could be, interesting to look at. But whenever I have clients who say, okay, what should I feed to? Part of it does come back to, what do you want to feed and what does your cat like to eat? Right? I've had many clients where you give them this diet and they've come into me and they're saying, my cat won't eat it. And I keep trying and it's still having issues. I'm like, try something else. And I know that sounds really simple and as we talk about it, but the reason then that again with our communication talks we've had is that I do think it's important to let them know why. We're doing that to hopefully shut down the stress that cat is having over the anxiety of the food. And so if I don't like to change diets quickly, I like to give preferences. I think Dr. Delgado referred to that as well. And many that might help tease it out too, you could offer the cats dry and canned and just simply let them choose and see then how signs respond. But I think it has to do more with, again, allowing them choices and preferences to, again, hopefully look at their stress response to it.
Right.
Yeah, the one thing I wanted to add, the kibble and the cat wheel picture was sitting on top of a feeding box because I do actually listen to my nutritionist friends, and I know I'm not supposed to have fat cats. And so what I did with our friend Scout, which is another bigger cat, he might have been an 8 out of 9. I actually got the idea for, well, maybe I'll have a feeding box for him, and then the little cats could have their kibble, right? So I had the hole in the box was about this big, and that he couldn't fit. But I kept telling him, once you can fit, you can have kibble. But I didn't realize that I was stressing the heck out of him because there's kibble right there and he couldn't get to it. And it was a horrible thing that I did to him. I actually made him lose weight by doing it once. And then I realized I'm lucky that he didn't get FIC and block because of the stress that I induced by mismanaging his feeding plan.
So I guess going back to the study that you presented with the 2 diets with different sodium levels, I mean, if that was a real effect, small numbers obviously, but if that was a real effect, then presumably the increased water intake, increased urine volume may have been part of the reason for response in those cats?
Well, you know, it's a nice theory, and Dr. Greco and the team, you know, helped me get my mind around that a little bit. Again, we need more samples. There are more cats in that study. I did choose just to show you what we had done at ACPIM, just to stay true to my own rules. It has to be published. But the specific gravities didn't match what I might have felt was going to happen, so I'd really like to continue to enter cats for a little bit longer, just so that we can see if those kitties that were on a dry food with higher sodium would actually have an effect that we could easily measure, you know, and specific gravity is the only thing I can think of easily to do.
Sure.
Yeah, so we need a few more cases before we call it good.
Keep calling the shelter.
Yeah, I'll keep calling the sponsors.
Okay, another question for Dr. McGowan. And I guess a lot of us struggle with this with our owners and clients. So a lot of litter box management for cats seems to be trial and error. Have you seen any trends for types of litter boxes, types of cat litter, or placement of the litter boxes that tend to work better than others?
This is another fabulous question. So first caveat is that cats are very much individuals, just like us people, so they'll have different preferences, and based on their own experiences, they may decide what types of litter or litter boxes they prefer. But in general, we can say that for the most part, cats prefer open litter boxes. We need to keep in mind that they, as well as being predators, they're prey species, and they're putting themselves in a vulnerable position when they're eliminating. So the ability to see the horizon and look out for their surroundings while they're eliminating is appealing for them. So for the most part, cats enjoy open boxes. This is counterintuitive to humans that like to kind of conceal the area where their pet is eliminating. They also enjoy loose, sandy soil, so the paw feel there and the ability to actually select a place to eliminate and then to cover their elimination afterwards. So those loose, sort of sandy, clumping litters are very appealing for cats. Big open spots, and also enough space to actually get in, turn around, and do all of the elimination behaviors that they're motivated to perform in order to complete that elimination sequence. So very large boxes that are wide open with loose, sandy soil. So this is counterintuitive to what a lot of people assume their cats need, and then also the desire for people to be able to tuck litter boxes away and have them all covered up and have them be very small and compact, especially if you're living in a small apartment or such. But keeping that in mind for your cat, that they would enjoy the experience and probably have better litter box compliance if you have larger boxes with more open space for them, is good. And as far as placement within the house, given that high traffic areas can be stressful for your cat, having them in a place where they can see everything but not be in the middle of the hustle and bustle of the world seems to be more preferred from their perspective. But as Jody was just describing, providing pets with choice is optimal. So if you can try putting multiple litter boxes in your house in different areas and let your cat choose the space that they prefer to use, then that's the best option.
Great tips, thank you. Another question, actually for Dr. Lappin, but I think for both of you really. Do you have any data, or is there any data on rates of urethral obstruction in cats where you're trying to medically dissolve struvite uroliths? So you get the radiograph done, you've got the uroliths there, put them on a dissolving diet. How many of those cats end up getting urethral obstruction?
You know, every time I talk about Camille's study, I get that question every single time, and I have in all the audiences, and I bet I've shown that at 30 or 40 talks, I've had one person say, well, once I was trying to dissolve a tomcat stone and it blocked. I have not recognized that in the case numbers that we've done, but again, these are fairly small. And I read all the manuscripts again, obviously, to come here, and I don't remember any report
No, there's
in the stone dissolution.
2 other papers as well, looking at struvite dissolution in cats, and in addition to yours, and just like your papers, none of those cats, to my knowledge, either obstructed, and the same thing, I mean, we think about dogs as well, and just think about when struvite dissolves too, it's not breaking off in chunks, right? It's disintegrating really slowly, so they're tiny, tiny little pieces that should go through. I tell my clients, sure, it's a possibility. We warn them, but clinically too, I've never experienced it, and the literature doesn't support it either.
And we have a lot of folks that do this as well. Has anybody seen a tomcat that you thought blocked during the dissolution phase?
Is that a 1? No.
Not a yes or no. We got a really good cat guy right there. I see you shaking your head no. So awesome. Oh, we got a microphone.
Yeah.
Sure. Mike, this is a question for you, and I was certainly, it's very impressive that you, and wonderful that you do all this work in the shelter, and your studies that you did with the diet for, cats that were being relinquished because of urinary issues. And your comment that, the money runs out, and that special diet that seemed to be very beneficial may not be available to the shelter long-term, or do you have any suggestions on what kind of diet, a diet alternative that the shelter people could be using, or even the people who adopt these cats, like based on the nutrient profile and what you think is working in the diet that helped with your study? Is there a diet recommendations that you could make when that diet is not available anymore?
Thank you so much. That's a great question. And honestly, we don't know, right? Because we don't exactly know what's happening in many of those kitties. The ones that dissolved, were obviously probably struvite, but those cats were probably also FIC cats. Because they're not bacterial infections, right? So they've got to have some other event that's making those magnesium phosphates, come out of solution. And so I'm not sure that it makes just as much sense to have them be the canned food cat, any canned food, if they can't afford a urinary diet, and then follow Jody and Tony's pathway of doing other multimodal things to lessen stress. The calcium oxalates are a little bit trickier though, right? Because then we might need to try to manipulate them longer term, and I don't know that we have a lot of other things that I would do other than trying a diet.
Yeah, I mean, water to me, I'm a little moisture, I'm a little on the fence, with FIC. I try it, especially as I mentioned, the obstructed cats, right? We really, I think it's vital there. It may or may not help the other, the non-obstructed ones. In stone disease, it should be done if possible, and it's hard in cats. And certainly, in the ACVIM consensus statement, we said, okay, if you can try canned food to help that, great. That's probably the best way to start. And if the cat won't accept it, or in some cases, and one of them, the owners don't want to feed it, right? Because that also has to go into it, then maybe try some of the higher sodium diets to see if that could be of benefit. And certainly there are, sodium's controversial in the literature for humans because it can be a risk factor for calcium oxalate because it does increase calcium excretion. But there are data in cats and in dogs looking at higher sodium saying, hey, yeah, the urine calcium does increase in excretion, but the concentration and the RSS for calcium oxalate actually goes down. So probably due to the dilutional effect. So we have a lot better evidence, I think, too, for stone cases. And I really do try to work and get tailored plans for my calcium oxalate cats and dogs. But the FIC ones, it's a lot of, to be honest, trial and error, I think. Comes back to it.
Great. Thank you for that question.
So that was I think you answered my next part is for these over-the-counter diets that you're suggesting, would you have a special recommendation on looking at sodium levels for dry food versus canned food and kind of giving them some guidance from that perspective?
Yeah, I think that's a really good comment. And build back on, you made the sodium statement, and we chose, because of sponsorship, to study a little bit higher sodium diet. It certainly is intriguing that would be the pathway to follow.
Okay. So there's 2 or 3 people that have asked the same question. Just going back to that study that you showed with the FIC cats, Mike. given that the disease often resolves on its own within 5 to 7 days without treatment, how can you be sure that the diets you fed had anything to do with the resolution of treatment?
Yes, and thank you for that comment, the person, I think, online person. That's a really good comment, and I think in both the ACVIM abstract and the subsequent paper, once we think we have enough cases to actually report it, we'll be very careful on how we describe that. We have a hard time, right, with the shelter studies because we absolutely would never get a shelter cat in a placebo-controlled trial, and I wouldn't ask for them. Again, those animals can't control their own destiny. They've been relinquished by somebody that usually doesn't have any money, and I do not believe in negative control studies in those situations. And so what we were trying to do was have really the major difference was the sodium concentration, honestly, between those two diets. And so we were trying to standardize it the best we could in that situation, but just didn't feel comfortable doing, just a cat food, versus a urinary type diet. So we won't be able to do that, which means we might not be able to get it through review because you guys are great critical reviewers, as you should be. But it is, we'll try to discuss it fairly when we get to it. I was just impressed by the numbers with being very, very much a pilot study that we actually saw the numbers that we did. It just seemed unlikely that would have just been randomization related, but we need at least double those numbers to make sure the trends continue that pathway. But yeah, it's a great thought. It'd be great to have a third group that we just put them in a nice the similar housing and just see how much it was stress related. Like we were able to build it into the respiratory study that I mentioned only because we had a 3-day equilibration period. By the time they came to the research room, we had written that in. We weren't going to start them in one of their treatments, the respiratory vaccine versus the alpha-2b interferon. So we did have that kind of buffer zone that we had 25% drop below entry criteria. I guess perhaps I could do that with a shelter cat FIC study, or maybe one group with just discomfort control, maybe GABA or something. Yeah, it'd be great. Whoever asks the question, give me an email later. I think I had my email up a couple times, and those of you that want to brainstorm studies, I'd love to see you at the event tonight.
Great. For you, Jody, there's a question about occult bacterial infections, essentially in the urinary tract. So they comment on a study about looking at bacterial DNA in urine samples from cats that are culture negative. Do we have any information about occult bacterial infections and what their role might be in FIC or other urinary tract disease, and whether that means we should be using antibiotics more?
Yeah. Well, my colleagues always I'm always going to probably end up voting for using antibiotics less. And I think the more we find out as well, and again, I get more cases in now where I am basically telling the clients, we need to stop the antibiotics, your cat's not clinical, okay? So, or your dog isn't clinical. Which opens up to say, all right, as we're looking at this, is subclinical bacteriuria now, I have even more kind of thoughts on perhaps some of these bacteria are actually they are beneficial and maybe they are protective. What role then, though, could, if there's a urinary, let's say, dysbiosis, what role could that possibly play in afflicting some of those cats with then clinical signs causing, say, contributing, I will say, to maybe FIC signs or stone formation? So I think it's a really interesting area to begin to look at as we're understanding maybe, again, more about the urinary microbiome. And I think, in veterinary medicine, I think at least now we're all open to at least knowing that sometimes the bacteria in the bladder, whether it be a cat or a dog, it could be okay. And that does occur, and we don't need to treat it. And then what bacteria aren't okay, I think, is where we're trying to decide how that comes into play and what to do with those.
Great.
Yeah, a couple comments on that. I think that was one of the hardest things about the ISCAID second edition of the urinary guidelines, wasn't it? The asymptomatic or subclinical bacteriuric animal where you actually see it. It was a tough call. And then Jan, I think Jan had to step out. I don't see him right now. We were debating the urinary microbiome issued earlier yesterday. Is it real? When you look at the sequence numbers and concentrations. It's so low, is it real or not? So I think we do need more work with the urinary microbiome or bladder microbiome. And we do have data now with a resident that just finished that we looked at kidneys in the old cats. They were 10 years or greater. Approximately half already had an iris stage of some form, then the others were euthanized for other reasons. So we're in the middle of analyzing that data, but it's pretty interesting how the ones that we grew bacteria were the ones that looked like they had a bacterial infection, and the ones we didn't, the DNA wasn't very exciting. So it'll be fun to continue that work.
I mean, just along that too, sorry, you brought up an interesting comment. So, we have a study going on in dogs right now, but we're either treating them with antibiotics or we're putting an asymptomatic strain of E. coli into the bladder as the therapy. And we presented the preliminary data at ACVIM. So right now we're trying to do a non-inferiority study. Right now I'll tell you the groups are all about similar. We need higher powers to prove non-inferiority, but they're not doing any worse, at least, than the Clavamox group. So there are probably some bacteria that should be around and colonized, but we have so much work that could be done in that. So it's really exciting too.
So you don't give convenia to your FIC suspects?
Never even gone to the pharmacy for it.
I had to ask.
Great. Dr. McGowan, I've got another question for you. Back to litter box and substrate, litter substrate for cats. So talked a little bit about the scented litter. But the question really is, if you look at different litter substrates, some of the litter substrates that we use do have a natural odor to them. Is there any information about those natural odors, whether some of those are preferred or the opposite to being preferred in cats?
Yeah, another great question along this line. And again, I'll nod back to the fact that cats are very much individuals, so they'll have individual preferences when it comes to that. So testing out different scents with your cat and sort of seeing how it goes, that trial and error again, even though people don't like hearing that, it does work to find the scent that's most appealing to your cat. But I will say that we have done some work in some of those more natural litters that have a very, very strong odor, like a pine odor or a very strong citrus odor. They do seem that for many cats, they're not appealing. And can actually drive them out of the box. So in thinking of these more natural litters, taking into account how pungent and strong the scent is, especially given how sensitive felines are, just like canines, to these scents and the chemoreception. And so something that's strong is very pungent and strong to us, it's even more so for them. So these more subtle scents seem to be more appealing to cats. But again, there's some cats that enjoy eliminating on a lot of different substrates. So for your individual cat, it's good to provide some choices and do that sort of trial and error.
Nice. Thank you. A question for both Mike and Jody, I think. The question is, what about the risk of development of kidney disease if we're using diets with higher sodium content?
Well, I mean, my understanding is that unless you're already abnormal, extra sodium within that range does not actually cause kidney disease.
Yep. Agreed.
There we go.
Okay. Yeah. Do we need Quimby? So.
Always good to have a straightforward one, isn't it? So, for you, Jody, what do you think about a high starch diet and the potential for that to increase calcium oxalate stone risk?
I think it depends. I might need a little more information, and I probably would defer to my nutritionist on this. I go to Dr. Larson a lot frequently during the day on these things. I think it depends too, right, on the whole constituent of the diet. So what is the carbohydrate content? What is the oxalate content of it? So I'm not quite sure on how to answer that, and I don't know. I'd probably defer to nutritionists to see. Is any other comments? But I simply just don't know that.
Yeah. Okay, we've got a question.
Oh.
Yeah, thanks. I thought I heard one of the panel members say that cats are chronically dehydrated. And did I hear that right? And if I did, how do we know this?
Yeah, I actually made that statement, and so thanks for bringing it up, but I was actually quoting someone else that said that, and so I don't know that we know that for sure. You know, we're always so impressed by a 1072 urine-specific gravity, but does that mean they're dehydrated, or is that within their normal being? So we'll be careful how we utilize that statement. I don't know if any of the folks in the room want to argue that point one way or the other. Are cats chronically dehydrated, or are they cats? Yeah, so it's a tough one.
Yep. Okay. Just going back to the urinary microbiome. So we've got a question that's come in. Can you elaborate a little bit on the urinary microbiome? And if there is a urinary microbiome, why are we not routinely able to culture that?
Well, some of them, from what I've read, require more enhanced culture techniques, so your standard blood agar McConkey won't pick things up. And then you might need to look again, as we said, with more kind of the multi-omic approach to see the small pieces that are there, and again, what is their function? What's the metabolome as well? So I think we're really in the infancy for this, to see where we're at with that, and if any effect it does have. But I think I think we do have evidence, though, that in cats, dogs, they're not sterile like we think. They could harbor some bacteria in there, and that bacteria in some could be beneficial, and sometimes it could be a dysbiosis, if you will, and might contribute to disease states.
Nice.
Yeah, and it's a tough one, because we got in a healthy debate just a couple of weeks ago with a colleague about the blood microbiome. The blood microbiome, right? When we've known for how many years, 50 years, that you get transient bacteremia. And so, just brush your teeth, right? So it's really hard for some of these body parts to say, is that a microbiome, or is that actually a transient bacteremia? I know there are bacteria in the Netherlands of creatures, and is that bladder microbiome really a microbiome?
Right.
Yeah.
That's a good point.
Yeah.
Absolutely.
Okay, another interesting question. If we have a cat where we're trying to encourage water intake for whatever reason, what do we know about placement of the water bowl and use of water bowls that have moving water or pet fountains, that type of thing? So I think I'll ask that to Dr. McGowan first, and then I'll ask Mike and Jody to chip in as well.
Sure. This is thanks for whoever asked this one, because this one's a constant debate about the moving water versus still water. There's a number of publications out there in the literature that have sort of shown that, again, it's up to individual cat preference. So at a group level, we haven't been able to demonstrate that cats prefer moving or still water, but individual cats will prefer one or the other. So I always encourage people to have water bowls in multiple locations throughout the house, again, in those less than high traffic areas, and to try out moving water and still water. So just having water available in a lot of places within your home can help cats to stay more hydrated. A lot of cats love playing in water too. They might jump into a sink and play with the faucet, or into a bathtub when the water's draining. And so they'll drink from those sources as well. So just providing those options for your cat can go a long way to encourage that hydration.
Great, thank you. Any additional comments?
Oh, I listen to my behaviorists and take their suggestions.
Yeah, no, I listened to Reagan as well, and so we tried. We have a couple of bubblers. We've got a couple of flat water ones. We've got water bowls all over the place because of the 9 animals. But the other part of it was the little tiny one that looks like a toilet. They all prefer that one, so they like to drink out of the toilet.
Just sticking with that for a second, Reagan. Do you have any data on the material that's used for the water bowls and how that may affect preference?
So that's not something that I myself have looked at, but there is a bit out there in the literature, and it was comparing ceramic bowls to metal bowls to plastic bowls, and it didn't seem to find, there was no significant difference in preference between cats. There was another study that actually compared filtered water to tap water, and in that case, this was shelter cats. They actually preferred the tap water. So they seemed to prefer that sort of more chlorinated smelling water. So again, I think that it probably depends on the cat's exposure and experience, but obviously we'd always encourage, to keep that bowl very clean, to use a material that, is easy to sanitize so that we're not introducing something else into the cat's water.
Great, thank you. And another question for you, which I guess was a kind of inevitable question. It's where are you going next with all of this data you're collecting about litter box use? Is there going to be more in-home testing? How are you going to expand what you're doing with that?
Yeah, thank you to whoever asked this question. So I tried to keep the talk just focused on the science behind developing these models and predictive indicators of what's going on in a litter box, but we have actually brought this to life in a smart litter box monitor that is available for use now with pet owners. It's called the Petivity, is our IoT brand for Purina, but the Petivity Smart Litter Box Monitor. We do have it in homes now with people, and so we're working with them to collect more data on cats and really understand additional insights into what's going on inside that litter box as far as a window into their health and well-being. Also interested in any veterinarians out there that would like to partner and include this in some of the studies that you're doing with cats and with these very specific disease states, so that we can better understand really how the litter box is a tool to better understand those early indicators of disease state ahead of getting to the point of needing clinical treatment, so that we can really be a partner in that proactive health for the cats. So it's out there, and anyone that would like to partner to learn more about what's going on with cats in the litter box, reach out, please.
Fantastic. That is a great note to finish on. We've run out of time for the Q&A session, but please join me in thanking our three speakers for this afternoon.